Okay. All right, today we're going to do an incentive spirometry video. When you come in, obviously, we're going to do the professional appearance and behavioral checklist. And this one, now we're going to do the complete checklist. So you have to be in scrubs and a lab coat. You have to have your nails the appropriate length, no acrylics, no tips, natural color, trimmed appropriately. So the whole spiel here we're going to be checking on. Make sure you're prepared for going to clinic in the summer. All right, and then we will also give you a sheet to document on. This is an official record. You have to document on this as you would for a real patient chart. So blue or black ink, signature, first initial, full last name, credential, which would be SRT, and the date. And then you're going to fill in some of these things here. Okay. All right. So I have gotten a call, and my order says volume expansion therapy per protocol. So in that particular situation, I would need to bring equipment for volume expansion therapy, and I don't know if my patient's going to need incentive spirometry or IPPB. So I would be bringing all of that equipment with me, but today we're just going to bring the incentive spirometry equipment with us. So the things I would need would be my IS, which comes with the tubing, the mouthpiece, and the directions, nose clips, my documentation. I would, and obviously something to write with. I would need a pillow for splinting, if this was a post-op patient. I would need a pulse ox, possibly some oxygen equipment, which we normally have on a cart that we bring with us. And then hopefully the patient has some tissues for coughing, but in case they don't, I can go and get some of those. So let me just go and get my equipment, and I'll be right back, okay? My pillow. I'm still outside the patient's room, by the way. So I've gathered my supplies. I'm in the hallway right now with my supplies on my cart. And so now I'm going to poke my head in the patient's door and see if the patient's in the room, check for a STEAM survey, and check for the primary survey, which is ventilation, oxygenation, circulation, perfusion. And my patient looks fine. So I'm going to come back out in the hallway, and I'm going to check the chart. I'm looking for orders on the chart, the patient's diagnosis, any prior therapies the patient might have had, especially if they had pre-op instruction on incentive spirometry. I'm going to check for a chest x-ray, surgical report to see if the patient had abdominal or chest surgery, pain medication, when's the last time they had pain medication, microbiology results, cold status is always good, allergies, things like that. So I'll expect you to list a good chunk of those things on the list. Now we're going to be doing volume-oriented IPPB, and you'll be either doing it on Ms. Clark or Ms. Alstead. All right. And this is the one that's most common in the clinical site. Now, the other style is the flow-oriented one, so you're going to have to basically know the difference between the two. We'll be asking you some questions about it. So the flow-oriented one requires the patient to raise a ball and maintain a ball in a certain place and then count how many seconds they held the ball there. So it requires math. Much more difficult for the patient and the therapist, probably not as accurate. So you won't see those as much, but they are cheaper. So some people, buy things according to cost. So you'll have to know the difference between the two and how they work, but you will be demonstrating with the volume-oriented one, okay? So I have looked over my patient's chart, and I do have an order for volume expansion therapy. So now I'm going to come back into the room, and remember you have to have two identifiers. So I'm going to say hello, Ms. Clark. Can you tell me your full name and your date of birth? And can I see your ID bands? My name is Mary, and I'm from the Respiratory Therapy Department, and I'm here to assess you to see if you need some breathing treatments. I noticed that you just had some abdominal surgery, and sometimes people don't like to take deep breaths after they have that kind of surgery because basically it hurts a little bit. So I'm going to evaluate you to see if you need some assistance in taking deep breaths and coughing, because we really don't want you to have any complications, any lung complications after your surgery, okay? So that's why I'm here. So introduce myself and the reason why I'm doing the therapy. The next thing that you're going to want to do is interview your patient. So I'm going to ask her some questions. So how are you feeling today? Are you having a lot of pain? Okay, that's good that you're not having a lot of pain. I also want to see if she's having any shortness of breath, if she's coughing, what she's coughing up, and if it's bloody. I want to see if she's got any swelling or pedal edema, any chest pain, or incisional pain. That's important to know too. Fever, chills, night sweats. So what I'm listing out are the 7 pulmonary symptoms. Also want to know if she's using oxygen or anything like that. Okay? So I've evaluated that, and so now I'm going to go and wash my hands, and we actually will have hand sanitizer here for you so that you can do that. Okay, I just washed my hands and used hand sanitizer, so I'm okay. But since you'll be performing these tests on us, we'll have hand sanitizer here for you, and we'll have our filters and mouthpieces as well, so we can use the equipment. All right. So what I would like you to do now at this point, although it's a little bit out of order on the PE, I would like you to position the patient and teach the patient splinting before you go on to do the rest of your assessment. So is it okay if I put the head of your bed up? Because I'd like you sitting up nice and straight for me when we do this. Of course, if it's a real patient, you might have to boost them up in bed before you do this. All right. So I want to have the patient sitting up, and I'm going to teach you a little exercise so that we can kind of decrease the pain that you're having when you cough and deep breathe. So I'm going to give you this pillow, okay, and you're going to hold it nice and tight across your abdomen. Okay. And when you take a deep breath and cough, you're going to hold this really tight so that your incision doesn't bulge. Okay, now help keep the pain down. Okay, do you understand that? Do you have any questions? Okay, so we're going to keep this here while we're doing your therapy if we decide you need some. Okay? All right. So once I teach the splinting and I position the patient, then we can do the physical assessment. So what is the systems assessment for physical assessment? Well, we do our initial impression. She actually looks pretty good. Okay. And then we work our way down, so we're going to do the neurologic assessment. So alertness and emotional state. We want a patient that's alert so they can cooperate and that they're calm and willing to perform this procedure. And then I'm just going to work my way down. Head, eyes, ears, nose, and throat. So I want to see that she can put a mouthpiece in her mouth and take the treatment through her mouth. Anything else that I would notice that would interfere with therapy, the neck comes next. And then it's pulmonary and cardiac, abdominal, renal, and extremities. So you just kind of work your way down the patient. In this particular case, the abdominal assessment is the incision. Probably isn't anything renal that I need to do. Extremities would be color and skin integrity, make sure she's not shocky or anything like that. And as far as cardiac, we want vital signs, heart rate, respiratory rate, temperature, pulse oximetry, probably not so much blood pressure with this particular procedure. And then respiratory inspection, palpation, percussion, auscultation. So what do we got? Breath sounds and work of breathing and things like that. All right. So if she's got atelectasis or consolidation and needs volume expansion therapy, you know that she may have some bronchial breath sounds because that's what goes along with that. All right. And so, or maybe she has some secretions and some bronchi as well. So hopefully those will get better, after our therapy. So we want to do our assessment before and then assess our patient after to make sure we have an outcome. All right. So as I'm doing this, I would be documenting on my SOAP note. I'll talk about that, at the end, okay, and how I want you to document. All right. So I'm going to ask my patient a couple questions now because I've decided that being a post-op and having some incisional pain, I might evaluate her to see if she needs incentive spirometry. So I'm going to open this package up right now, and I'm going to get out the directions, and I'm going to ask my patient a couple of questions. So I would like to know what her height is. What's my patient's height?
5'6".
5'6". And my patient's age?
29.
29, and my patient is a female. So I'm going to open up the chart. I'm just going to figure out a normal value for you. So go on to the chart, female, 65 inches, and we're going to use 2,600 as our goal. Put that on, do not contaminate it. Okay, now if 2,600 is my goal, then, because I'm a good therapist and have a calculator and my notepad, I'm going to figure out what 80% of that is and what 33% of that is. So 2,600 times 80% and 2,600 times 33%. 80% would be 2080. 2,600 times 33% would be 858. Okay, so if it's over 80%, then I'm just going to continue to encourage deep breathing and coughing. If it's between the 33 and the 80, it would be incentive spirometry, and if it's less than 33%, then I need to consider IPPB therapy. All right. So now I have to instruct my patients. I'm going to have my patient sit up at the side of the bed, so we can pause that for a second. All right, so our patient is evaluated, and now we're going to do the instruction for the incentive spirometry. All right, we're going to do a little test here, Ms. Clark. This is called an incentive spirometer, and what you're going to do is you're going to exhale normally, and then you're going to put your lips around this mouthpiece, and you can hold it in your teeth, and make a nice tight seal, and breathe in as deep as you can. Okay? And then I'm going to have you hold your breath a little bit, and I'll tell you when to stop, and when you're finished holding your breath, you take the mouthpiece out of your mouth, and you just exhale normally. So that's the way it works, and what you'll see is this little yellow piston will rise up as you breathe in. Okay, let's try it once, and I'll just walk you through it, all right? So you can hold on to this, just hold on to that, okay? So exhale normally, put the mouthpiece in your mouth, breathe in nice and deep. Hold your breath, hold it, take the mouthpiece out, and that's it. That's wonderful. Okay. So looks like you got to about 15, right? All right. So 1,500 falls within the 80 to 33%. So we're going to continue this therapy. I'm talking to you, not my patient. Okay? So let's continue to practice that. Okay. Okay. So let's try it again. Exhale normally. Mouthpiece in your mouth. And breathe in. That was better. Hold your breath. Hold your breath. Hold your breath till the piston drops. Take the mouthpiece out and exhale. Now you got the hang of that part. Mm-hmm. All right, we're going to add a step now. Okay. I want you to watch this little indicator as you're breathing, and when you breathe in, see if you can get going to stay in that little box.
Okay.
Okay? So that means you're breathing in at the right speed.
Okay.
All right, so exhale normally. Release in your mouth. Slow, deep breath. That's great. Keep going, keep going. Keep. Hold it, hold it, hold it, hold it. Release in your mouth. That's it. How do you feel? Okay. You feeling lightheaded at all?
A little lightheaded.
A little lightheaded. And sometimes that happens with this therapy because you're probably breathing deeper than you normally do. So we like you to take breaks. So when you're feeling a little lightheaded, just stop, okay? And wait a few minutes before you take your next breath. Okay?
Okay.
Now this is a therapy to help keep your lungs open and to prevent any post-op complications. So we're going to have you continue this therapy throughout the day. Okay? But what we're going to do right now is finish